Patient education is a vital component of the surgical experience and significantly influences patient outcomes. Effective preoperative teaching reduces anxiety, improves cooperation, enhances recovery, and minimizes postoperative complications. The perioperative nurse plays a central role in assessing learning needs, delivering education, and ensuring patient readiness for surgery. The primary purpose of preoperative education is to help the patient understand what to expect before, during, and after surgery. When patients are well informed, they experience less anxiety, actively participate in their care, and demonstrate better compliance with postoperative instructions, leading to improved surgical outcomes. Preoperative teaching can be delivered using multiple methods, such as one-to-one discussion, audiovisual aids, demonstrations, and return demonstrations. Using a combination of methods improves understanding and retention, especially when patients are anxious or overwhelmed. Effective teaching begins with a comprehensive assessment. The nurse determines what the patient already knows, what they wish to learn, and how they are coping emotionally with the upcoming surgery. Cultural and religious beliefs that may influence care, such as refusal of blood products or special rituals, must be identified and respected. Teaching should be tailored to the patient's level of understanding and readiness to learn. Family members and significant others should be included whenever possible, as they provide emotional support and assist in post-operative care. Active patient participation improves confidence and self-efficacy. Patients should receive general information about preoperative preparation, the surgical procedure, expected duration, and post-operative recovery area. Explaining the PACU environment, equipment, and activity helps reduce fear of the unfamiliar and reassures the patient that close monitoring will be provided. Patients should be encouraged to ask questions and express concerns. Answers must be honest and consistent with the overall plan of care. Explaining that surgical delays are common and usually unrelated to patient safety helps reduce unnecessary anxiety. Keeping family members informed is equally important. Preoperative instruction in incentive spirometry, deep breathing, and coughing allows the patient to practice these skills before surgery. Deep inhalation expands alveoli and prevents atelectasis, while proper coughing techniques help clear secretions and reduce the risk of postoperative pneumonia. Teaching patients how to turn, reposition, and perform leg and foot exercises improves circulation, prevents venous stasis, and reduces the risk of deep vein thrombosis. Regular repositioning also promotes lung expansion and prevents pressure injuries. Skin preparation reduces microbial load but does not sterilize the skin. Hair should not be removed unless necessary, and clipping is preferred over shaving. Gastrointestinal preparation is essential for bowel surgery. Patients are kept NPO to reduce the risk of aspiration during anesthesia. Informed consent is a legal and ethical requirement before any surgical procedure. The responsibility for obtaining informed consent lies with the surgeon performing the procedure. Consent must include an explanation of the diagnosis, nature and purpose of the procedure, potential risks and benefits, possible alternatives, and the consequences of refusing treatment. The nurse's responsibility is to verify that informed consent has been obtained, that the consent form is correctly completed and signed, and that it is present in the patient's record. The nurse must also assess the patient's understanding, ensure the consent is given voluntarily, and notify the surgeon if the patient expresses confusion, fear, or refusal. Witnessing the signature does not mean providing the explanation, but confirming that the consent process has occurred appropriately. Prophylactic antibiotics are administered shortly before incision to prevent surgical site infections. Accurate timing is critical. The preoperative checklist ensures patient identification, consent verification, allergy review, laboratory results, and readiness for anesthesia, enhancing patient safety. Final preparation includes ensuring correct attire, IV access, removal of personal items, and patient comfort. Families are directed to waiting areas and informed about post-operative expectations. Clear communication reassures both patient and family and promotes a smooth perioperative experience. Please like, share, and subscribe, and leave your questions as comments.